Hello and welcome everyone to our well-being webisode titled Social Needs. Let's explore the impact on health. So my name's Emily. I'm a health services specialist here at Geisinger, and with me today I have Maria Welch. So Maria is the Director of Community Health and Social Needs in our Health and Wellness Department. And she also has a master's in public health and is a certified health education specialist as well. Today, we're going to dive into the impact that social needs has on our health, and we're also going to uncover some great tips and resources to address these needs. So just a disclaimer before we get started, this information is being provided to increase your awareness. It's not intended to be medical advice, and if you believe that you have any certain or specific medical conditions or have any specific questions regarding your health, we ask that you do see and talk with your physician. So welcome, Maria, and thank you so much for joining us.
Wonderful. Hello. Good afternoon. Thank you so much for having me.
So we have a lot of great questions and a lot of great information to discuss today. Social needs is an important topic, but it's often not talked about enough. So really just to kick us off here, I think it's important to give some background on what exactly are we talking about today. So Maria, what are social needs or social determinants of health?
And that's a great question. And, formally health-related social needs or social needs, sometimes these terms are used interchangeably, but really what it comes down to is they are really the things that affect our ability to be healthy, maintain our well-being. Examples of those include, struggling for healthy foods or food access, employment, personal safety, lack of transportation, housing instability. So really the things that can impact our overall health. They could be situational, they could be long term, but either way, they're things that could impact how we feel, how we seek out clinical care, how we live our lives day to day. And certainly, we're here to not only share what they are, but as Emily mentioned, talk about resources, talk about ways we can get connected and really where those resources are in our communities.
Yeah. And thanks for the explanation, Maria. I think that's a great summary. And when it comes to our health and wellness, some of these needs, they might be overlooked. So we might think that our health behaviors like our smoking status, our physical activity and nutrition play a large part in helping us live a happy, healthy life. But can you explain why it's so important to focus on these social factors as well as our health behaviors?
Yeah, absolutely. So I always like to think of it as those real life examples, and how they interplay with keeping ourselves healthy and how they're intertwined with our healthy behaviors. They certainly play a role. It's how what we might be struggling with, ourselves or our families. But if we think about kind of that clinical care, that overall well-being, if our doctor prescribes us a new medicine, and we have to take that with food. But a person's in a situation where they're unable to take that medicine with food because maybe they don't have food in their home or it's in between trips to the grocery store. That could be a barrier. That could be a barrier to carrying out clinical care. It could be a barrier to taking the medicine as prescribed. Or, for example, if we are prescribed a medicine that needs to be kept cold, but the individual doesn't have a way to keep that medicine cold, that could be a true barrier and have that ripple effect. So thinking where we can get those resources, having that connection and definitely that overlap with clinical care. So certainly a strong connection back to overall health behaviors. Certainly things that could be situational, but might not. And, oftentimes, where do we go to receive that help? So I think it allows us to live healthier lives, happier lives, and making sure that we know where, if situations arise, we can get those connections to resources in our community.
Yeah, absolutely. And I mean, even going back to our first question, seems like there's
Mhm.
so many different social needs that an individual can have. And some of us on this call, or maybe someone we know, might need help with one, or maybe they might need help with a few of them.
Mhm.
Do you have any statistics or data that you could share with us that portrays how people are experiencing unmet social needs?
Yes, absolutely. So there's a lot of stats out there, but I think, recognizing that it's, um, not as uncommon as people might think. So there's some stats that say that up to 68% of individuals have an unmet social need. So could be experiencing one or more situations in their life that need additional assistance, and that's okay. That's why we have these conversations, to be able to offer to help. But they could be coupled with a change in healthcare. It could be a change in a situation. COVID, even though it feels like a lifetime ago, really brought a lot of uncertainty into individuals' lives, that changed things, that impacted our everyday care, social needs. What we typically see in Geisinger patients is about 1 in 5 individuals have at least one social need. Certainly could be higher in certain populations. In our membership population, that number could be higher as well. But I think the best thing to talk about is the ability to know that we can talk to our clinical teams about it. We can talk to our care teams about it. And there's a lot of resources out there that continue to make this an easier journey, an easier opportunity to reach out, and also find things that are in our own community that we're familiar with.
Yeah, I think those numbers really show how important this topic is, 1 in 5. And knowing that many people experience one or more unmet social needs, I'm thinking that the needs impacting each person are different, or maybe there are some trends going on. So, Maria, what are some top adult needs, or maybe some top needs adults want the help with?
Yeah, absolutely. Certainly, we see some seasonal changes, which I'll talk about here in a second. But what we're seeing currently is it's common when we understand the social needs. Food is generally one of the top ones that people share, that they might have a need for. I think second to that is, employment resources, utilities, and transportation. Certainly, a lot of those are connected in some way versus another. But what we also learn from individuals as we have these conversations is, where do they want help? So they might be sharing with us in a more formal way that food is the top need, or utilities, et cetera. But they also let us know what's important to them. And I think that's, again, when we think about that connection to our clinical care or health plan, being able to have those conversations with individuals who we're connecting with or reaching out to, but learning where those resources are. We hear from individuals that housing is a really important need, one that they want help with, and then second to food and utilities, which I think is a really important call out. Like, sometimes needs are seasonal, and that's okay. Sometimes, like, the weather is getting colder, and what we experience in the winter could be very different than what we experience in different times of the year. So sometimes needs, again, are seasonal. We tend to see higher utility needs, housing needs in the winter, higher food needs towards the end of the spring into the summer. But that's not to say that needs don't occur at different times. It's just things that we're starting to see from a trending standpoint. But it also helps us to know and to provide resources.
Yeah, and I think that's a great point. Even if you may not have the need right now, it could be very situational, or can come up depending on the year or things happening in our life. And I know, Maria, you listed transportation as one of the top needs, and I could see how that could be so important, from whether it's going to work or going to appointments or different activities that you need to attend. Can you tell us how a need like transportation can really impact our overall health?
Yeah, it's definitely a need that has a lot of connections, one that we rely on to get, appointments to go to our healthcare. Social activities is another one, meeting up with friends, or whatever that might be, or going to the grocery store. So we rely on transportation a lot. I think you mentioned, Emily, about going to work. It's how we get to and from. And for individuals who might have limited transportation resources or have situational challenges, it certainly can change a lot of things that we might do on a daily basis, weekly basis, that either are, helping us to get to work, helping us to go to the grocery store. Again, things like that, things that we do routinely, things that we do during the time of year that might be unique. But certainly having transportation or tapping into transportation resources that might be in your community are so important. And that might look a little different depending on where we live, in across Pennsylvania. Sometimes we have more resources than others, more opportunities for public transportation might be in some areas and versus others. Some of our rural communities have some less resources available, but certainly can have a big impact when we think about all the things we use for transportation.
Yeah, literally so many things, and I feel like it probably all has a chain effect too with food and medication and all that. And I know also listed as one of your top needs was food. So I think we strongly associate nutrition with our health and wellness, but not having access to foods adds a whole nother layer really to consider, to work through. And during certain times of the year, like we were saying, maybe certain life events happen, or maybe there's this big snowstorm you don't want, but that could really hinder. But it could be more difficult to afford healthy food, especially too, let alone
Mhm.
just food. So can you explain how not having that access to healthy food or how food insecurity can play a part within our health and wellness?
Yeah, absolutely. I always think of food as the thing that often starts the conversation. So when we think about having conversations around social needs, oftentimes people are more open to talk about their food needs because it's for themselves, it's for their families. And the great part about that is it allows, clinical team members or team members through the health plan or individuals you're interacting with to start to understand, are there other needs outside of food? So even though the conversation starts around food, it can be a great way to feel comfortable, especially if you or someone is needs assistance. It's okay. It's okay to start somewhere. It's okay to share that with somebody to receive help. But when we think about food specifically, outside of that conversation starter, there definitely are a lot of diet related conditions. So I think of diabetes. That's one that it's important to be working with not only your clinical teams, but making sure that you have food access or healthy food. And if not, there's a lot of things that can happen in between to assist. So that's one thing, and how it ties into overall health. Definitely though, if you think about food, we don't want to, having to make different choices now between, going to the grocery store, paying a heating bill, paying for a medicine. We don't want to have to make those choices. We certainly want to make sure that we can support all. And again, if you're in a situation where you might need or making those decisions, certainly having those conversations is a way to receive help. But outside of kind of that clinical space, healthy foods for yourself, for your families, it can have that ripple effect of making sure that we're keeping ourselves healthy, but also our families.
Yeah, absolutely. And I really feel like we could have an hour-long webisode on every single one of these needs because there really is so many and how they play an important role within our health. And it seems like all these social needs really play a part in each aspect of our wellness, right? Physically, emotionally, mentally. Maria, can you tell us how these social factors can possibly affect maybe our mental health and wellness as well?
Yeah, absolutely. If it's something that we haven't had to face before and we're working to look for resources, it definitely could be something new. It could take a toll on our mental health, how we feel day to day, but also knowing where to go to get resources. That's being unsure of where to get help is certainly a real concern, and that could take a toll on our overall health and well-being. But also, like, if we are unsure where we can receive help, or going back to the food conversation, if we have to take medicine with food, etc. I think there's definitely tied to those factors that affect our mental well-being, health of ourselves, of our families, and just knowing that these conversations can occur in those different settings and getting people help, and knowing that there's resources available.
Yeah, absolutely. And I think to a good point you made, the unknowns can be a little scary sometimes. So I think really a lot of this conversation really just brings to light how important social determinants of health is and how they really do have a strong impact on our health and wellness. It seems like they really all go hand in hand and really affect each other. And you talked a lot about resources, so that's where I want to segue into next. So, what resources are available to help people address some of these needs?
Absolutely. So there's a lot of different places. The first one is Neighborly PA is a resource and referral tool that is available on the internet. It's available for an app or download, but it really helps that searching be easy, and it helps to find resources in someone's community, because that's the easiest place. To receive help, especially if we know of the places or want to share that resource with another. So I think it's a great place to start. It's a super friendly resource to look for information and see what's out there. Information is kept up to date on it. I think that's also important too when we are looking for resources or wanting to share it with others, or providing that site, making sure the information is current and up to date is really important. And Neighborly PA does that. It lets you know that the places you're searching for has current and up to date information. And then also it provides contact information. So if it's information you're looking for, want to share with others, you know when that organization is open, who they serve, what those resources are to get help, contact information. And then it also allows us to place referrals directly on the site if that's an action we're looking for. So that's one. Do check it out for yourself or for others. Again, it's available on an app. We talked a lot too today about that clinical connection or care team connection. So remember those resources we have, the people we interact with to keep ourselves healthy can be a great resource to help ourselves and have those conversations, or where to start or where to help somebody else. And also, there's a lot of resources in our own community. So the best resource is the one that you feel comfortable with, or the one the person feels comfortable with, recognizing that situations change. Also, every county has a community action agency. That's another social care resource. So lots of opportunities. If you're not sure where to start, Neighborly PA is a great place to get started and to look for information. But remember, those conversations with our teams that care for us are really important too.
Yeah, absolutely. And I think a great thing of what you said with neighborlypa.com is that you could put in your zip code, it's local, it's updated all the time. So I think those are some great features, and you bring a lot of great points here. I also um, shared that neighborlypa.com within the Q&A here in case anybody was looking for it. But I want to thank you, Maria, for discussing some of the resources that are available. Sometimes I think we don't always realize that these are available to us, whether it's for ourselves or to share with others. And to really think that some of these resources are just literally right there at our fingertips is really amazing. So some of these aspects we've talked about that come up in our life, they may be difficult to bring up, right? We might not always want to admit. And admitting and talking about needing help is a difficult thing to do, really for anyone. But everyone needs help sometimes. And I think that's also very important. So my next question is, what advice can you give to those who may be in need but are a little reluctant to speak up?
Absolutely. So if we are in a situation where we might be helping somebody else or someone else is sharing information with us, always remember to listen, ask questions where appropriate. And also, if we are hearing where somebody might need some help, because oftentimes asking for help isn't direct. If we're listening, if it's a friend, a coworker, someone we know well, or maybe have just met, oftentimes, they might share situations, they might share examples, but very rarely will people feel comfortable enough to come out and say, "Hey, I need some help in this, this, and this." So I think being a good listener, being a good friend, being a good coworker, or whatever the situation might be, and asking questions where appropriate, but also offering to be a listening ear, offering to help share resources where appropriate, and encouraging them that there are a network of organizations out there that can provide help in whatever way, or whatever the situation might be. And they do that with dignity and ease, which is so important, because if it's a new situation, we might not know where to go. But I would say, listen, if it's for us, just know that you're not alone. I think that applies to any situation. If you yourself are going through a situation, or a change, or not sure where to go, it's okay. And resources are available. And just knowing that there are, again, having those conversations with people that we trust, with clinical team members that we trust, or people that help in our overall well-being and mental health, is so important. And having those conversations, and recognizing that, again, there's lots of opportunities. It's not a one size fits all. So no one's here to judge, and knowing that help is there. So I think, Emily, that's a really important thing. And I'm glad we're talking about this. I'm glad it's part of this, because lots of ways to get resources, and the best one is the one for you, or if you're helping somebody, what's best for them.
Right. It's not a one size fits all approach. And I think you bring up great points. We're not just always going to come out, or any other person is not just going to come out and say, oh, hey, I need help most of the time. So being that listening ear, I think is a great tip to take with us. And just being there and supporting and all that. And I think on the flip side of this, some of us on today's call might not be experiencing some of these unmet needs at this time, but maybe they might be inspired to help others. And I think what you just talked about is alluded to that very well. And like we mentioned, many people keep their social needs to themselves, and are more private about it. So for those of us trying to help, are there certain signs that we should be looking out for, or what do you think is the best approach to navigate any of these conversations centered around social needs?
Yeah, that's another great question. I think, again, listening to what the person's sharing, listening to maybe what they're not sharing, and they're confiding in you for a reason, because they trust you. And I think most people, knowing that there's options. Again, everyone is in a situation where they might be ready to take the next step, get help, or that might be something they want to think about. But it, depending on where the person is in their journey, listening, providing resources, asking for their permission too, or saying things like, it sounds like, you might be struggling with this or this, or you shared with me some things. How would you like to receive help? Is it something, how can I help? What can I do? Might just be able to give them a resource. So I think asking for permission, asking to help, again, some of that goes back to how well you know the person, but it also could be a good way to say, it sounds like you might be looking for additional resources. If you want to think about it, or I'll leave you with this, neighborly PA is a good thing to navigate, but I'm always here for you. I think that a lot of different approaches you can take, but recognizing that every situation is different, but being there and offering to help, or being a listening ear is incredibly powerful. And sometimes just that reassurance as a person who might be going through it, knowing that someone's got your back, can change a lot of things.
Yeah, absolutely. Reassurance and being there and asking for permission. I think that's something we might not automatically think of when being in conversations like this. So I really think we can all agree that today's webisode was filled with a ton of great information that we can all take with us today. We can all spread the word and share about all these new resources that we know, and also how to navigate these conversations, right? So as we wrap up today, Maria, I want to end on one last question. So if there was one thing that you wanted everyone on this call to remember, you wanted them to take this with them today, what would that be?
One thing.
Yeah,
Just being
one
able,
thing.
one thing. I think it's knowing that, regardless of the situation, whether it be for yourself or for others, whether it be something new, or a situation that might have happened, a byproduct of something, or whatever it is, knowing that there's options, there's resources, but also a network of people who care and are ready and able to have these conversations. And just knowing that in this clinical space, health plan space, that there's people that can help. And I think that's the most reassuring thing, to know that there are options regarding wherever the situation might be.
Absolutely. I think that's a great way to end it, a great thing to take with us. So first and foremost, thank you, Maria, for sharing your experience, your tips with us today. I also want to thank everyone that tuned in today as well to listen to this conversation. Really hoping you all were able to take some of it with you, and also just share what you've learned today as well with others if they might need it. So we do have just a few minutes here to answer any questions that you might have. So I will pause here, and you can always use the Q&A feature if you do have any questions. I know sometimes questions can come up in our mind after the fact. We might not be able to think right on the spot and send in a question. I totally get that. So if you have any questions about anything Maria and I talked about today, feel free to always send questions or feedback to our wellness email. So it's wellness@geisinger.edu. And we'll be sure to get back to you with an answer for any questions you might have, because I know sometimes it is hard to think on the spot. But I'll pause for a minute. I'll see if anything comes through, and we'll go from there. I'm not seeing anything immediate pop through, and that's perfectly fine. Just like to give the opportunity. But with that, I will end it here. Again, if you have any questions, feel free to reach out at not wellness at geisinger.edu for any questions you have. And also, thank you again, Maria. Thank you again, everyone who tuned in. Be sure to join us next month. Our Wellbeing Webisode is focused on healthy aging, about living longer, living healthier, tips for healthy aging. So something you don't want to miss either. So thank you, everyone, and I hope you all have a great rest of your week.